Hey guys, it's Dr. Abraham with Valencia Medical Center. I'm here with Bianca today.
Hello,
and
everyone.
Welcome to our live at 5. So I know we received many questions. I think we're going to be talking mostly about Sculptra today because it's something that you people have been asking about and we haven't really got a chance to talk much about it before the last few weeks. But we can, talk about anything you guys want. But we'll start with Sculptra and kind of focus around that.
All right. We do have a couple of questions that were brought to our attention earlier. Can you explain a little bit about what Sculptra is, please?
That's a good place to start, I guess. So Sculptra is poly-L-lactic acid, and it's basically a material that is we inject it usually in the face, but we can inject it in most areas of the body, really. But it's poly-L-lactic acid, and it's injected to help induce collagen production, so it helps with wrinkles and folds in the face to help restore volume in these areas. So most of our clients like to get Sculptra just kind of in their face, just to kind of add volume, like in the cheeks and jawline and lower cheeks area. It works really good in the temples too. So
how long does it last?
So it does. Sculptra lasts a long time, more than most hyaluronic acid fillers. So when the studies were done, they looked at the clients when they first started their treatment and like 24 or 25 months after, so about 2 years after. And at the 2 years mark, most clients were still happy with the results. Mm-hmm. We were still seeing a difference. So in other words, that lasts 24 months or more for most people. Again, the studies were done and stopped at 24 months, so we know it lasts at least these 24 months for most people, but it can definitely last a little bit more in some people too.
Okay. I know we've had questions about the PDO thread lifts as well. Can you explain a little bit the difference between a Sculptra treatment and then PDO threads?
Sure. So I guess the similarity between PDO and Sculptra is that people use both to help produce collagen and stimulate collagen production, but they are a little bit different. So threads, most of the time we're using them to help lift. So especially for the mid-lower face, can also be used in the neck, can be used for an eyebrow lift. So threads are, for most people, threads can also, there's different types of threads, so we can use smooth threads only to produce collagen. But for the most part, when we're talking about threads, we're trying to lift. So we're trying to add lift this area, lift the forehead, lift the neck. In other words, we're removing the tissue, we're removing the fat. So with time, the fat a lot of the fat that accumulates in the jowls area. So it kind of goes, when we age, the fat kind of travels. If you want to think about it that way, you have more fat kind of down and anteriorly, so like around the jowls. So with the threads, we're actually trying to displace that. We're trying to lift that back up, move it back up, and lift the whole face. So that's what threads do. Sculptra is adding volume. So we're not really displacing anything with Sculptra, but we're just adding volume overall. And a lot of times we do add volume, like let's say preferentially in the cheeks or in the jawline, to kind of help with that, with kind of adding more volume there as opposed to the jowl, to kind of help restore that ratio of the fat, in the jowls, or the volume, I should say, the cheeks to the jowl. But Sculptra, again, is adding volume everywhere. Threads are more lifting.
Okay. Is there any side effects to using Sculptra?
So Sculptra is relatively safe. There's always bruising is very possible and happens with Sculptra, but usually it resolves within a couple weeks. Bleeding. Honestly, most of the time we see the thing that we see most often is just swelling and bruising. There are a few other things that can happen, but they're much more. They're a lot less common and more rare. Things like nodules can sometimes form like little granulomas where the Sculptra is. So if the Sculptra kind of aggregates or just combines in one area, it can form a little bit of too much collagen in there and kind of cause a nodule. That's one thing that can happen. But that's why we also always massage the area afterward, and we ask our clients to go home and massage the area for a few days afterward, just to kind of help prevent these granulomas from happening.
I think that sort of answers the next question too. Somebody said that they have an event coming up and they want to know if they, if doing Sculptra, would they look okay like the day of the treatment if they came in and had it done? Like what would the effects be?
No, we usually do recommend that you don't want to do it on the day of the event because it's gonna be a little bit too soon to see the effects of it. Sculptra does take some time because it's producing or it's inducing that collagen production. It does take some time to see the full effects of it, so it's not something that you're gonna do and see the final results immediately. So it's not gonna be very helpful to do it like right before an event. You're not gonna get these results. But because we talked about bruising and how you can bruise, it's best to do it at least like when you have 2 weeks before an important event, just in case you do get some bruising. You want to make sure you give yourself enough time to heal.
Okay.
You don't want to bruise and go to your event.
All right, and then how many treatments do you think would be needed for somebody? Does it depend on the person or for maximum result? For
sure, it definitely, an average number I would say for most people is going to be like about 3 treatments.
Okay.
Initially, and then after that, you can do a maintenance treatment every once in a while. But how many treatments and how many vials per treatment, how much we're doing in each treatment is going to depend on what area or areas are we trying to treat and how much volume we're trying to get for that client. So some people might just do one vial or 2 vials in a certain area because for one treatment because they're just kind of trying to maintain, or they just want a little bit more volume, a little bit more collagen production, as opposed to someone who wants like really full treatment. They might do the 3 treatments and might do more vials each treatment just to kind of get more of that effect.
How long in between treatments do you suggest they come in? Is it like a week, 2 weeks, a month, 2 months kind of thing?
Closer to a month. It's
Okay.
going to vary, but it's going to be closer to a month between treatments.
Between treatments, okay.
Yeah.
And I know we talked about it a little bit with the PDO threads, but what's the difference between Sculptra and other dermal fillers?
Sure. So most dermal fillers, when we're talking about Juvederm or Restylane, we're referring to hyaluronic acid fillers. They're both kind of sometimes considered fillers because they're also trying to add volume. So Sculptra and dermal fillers can be used to add volume, but there are some differences. With Sculptra, you're kind of inducing your own collagen, so it's kind of your own collagen, your own volume you're getting, and it does tend to last in terms of the results more than most other fillers.
Okay.
But you don't see the results immediately. With Juvederm fillers, you're gonna see results more immediately, when I'm trying to really shape or contour certain areas, I think fillers end up working a little bit better because Sculptra just adds volume in general in the area, but if you're trying to like really shape something or really define something, sometimes you can get slightly better results with dermal fillers, and you're gonna see results quicker.
Okay.
And there are some areas where Sculptra isn't indicated, like under the eyes and lips, for example. We usually don't tend to do Sculptra at the lips just because of the shape of the muscle of the lips. So there are some areas where we are restricted to only like certain fillers.
Okay. Is there any like pre-treatment or any advice somebody should know before getting a Sculptra treatment?
No, obviously you want to talk to your healthcare provider. It is a safe treatment, but there are certain contraindications. So there are some people where we don't want to do Sculptra, or we want to be very careful doing anything like Sculptra, especially with people with autoimmune disease, for example, because Sculptra is trying to induce collagen. There are some medications that we prefer to avoid before doing the procedure, if possible. Things like NSAIDs, Motrin, Advil, Aleve, because they can thin your blood. You'd have to kind of talk to it is a medical treatment, so you want to talk to your healthcare provider before you get it done.
Okay.
Just to make sure that you're best prepared for it. But generally speaking, these are the main things. The blood thinners, and some vitamins and over-the-counter stuff can also thin the blood, and then the autoimmune disease is another big one that we see a lot.
And like with most of the treatments that we do offer here, a consultation is always the best way for you to know if one of our treatments or if Sculptra is going to be the best fit for you at the time. But I know that doctor does have some befores and afters that we would like to share with you guys. We've had a lot of patients that have had Sculptra done and been some great results. So doctor's going to show you a few of our befores and afters.
Yeah, and as we were saying, the consultation is important because we can go over the things to kind of worry about before and after, but also just because sometimes people come in and they've heard about a treatment, but once we see what they're trying to get, we find that there's another treatment that might serve their purpose better. Trying to just open up some of the pictures here. I don't know if you can see it, but this is a before picture. Is it? You wanna see? I don't know how much you guys can see.
Yes, perfect.
So this is before. This is after. I think this was 2 treatments. So this is just them next to each other.
Is the glare off? Okay, that's perfect.
Yeah. So just the quality of the skin. There's just a lot more volume here. You can see in the cheeks and the whole area. I don't have actually tons of photos here. I was trying to access some of them, and I know some clients don't like us to put their photos, but this is another before and after. So just kind of side by side, you can see there's more volume in the cheeks, and just the quality of the skin is a little bit better. But also, if you just kind of look, again, the cheeks and the nasolabial folds, the lower cheeks, and kind of around the chin, you can see just some of the difference. So I know we have more pictures, but these are just the ones that I just was able to pull up right now. But yeah, like I said, and a lot of times we use Sculptra with other stuff, so we might use dermal filler, for example, to address lips, while we use Sculptra to kind of do cheeks, and then do Botox, for example, around the eyes. So consultation is usually the best thing to start with.
Okay, that's it.
Awesome.
That's all we have.
Perfect.
So thank you for
guys
joining us today. We appreciate it.
And we'll see you next week. Thank you. Have a great rest of your weekend.